Over the past couple of years, I've been trying to understand the plight of people with disabilities in nursing homes, public nursing homes, private nursing homes, large nursing homes, small nursing homes, publicly funded nursing homes, corporate nursing homes, and nonprofit nursing homes, rural nursing homes, and center city nursing homes. I found there is one common denominator within nursing homes: the looks on the faces of lonely and disconnected people. Not many self-generated smiles are seen. Sleep is the avoidance mechanism of choice. Recently, I spent an entire day on an unannounced observation visit of a 40-year-old gentleman with a developmental disability in a nursing home. I carefully maintained a log of what I observed. With the exception of mealtime, in an 11-hour period, there were a total of 21 minutes of interaction with others, including paid staff. No nurses, no doctors, no licensed therapist of any kind. No volunteers, family members, or friends. The only phone call was a wrong number. In fact, the most engaging interaction of the day came from a 7-minute one-sided conversation with the housekeeping staff. In reading his chart, it revealed that he required, in quotes, 24-hour nursing care. His record also indicated that he was eligible for nursing home care because he required, quote, constant monitoring, repositioning, and nurturing, end quote. A nursing assistant that came in at the end of the day documented in the progress notes that he, quote, had a good day. When I asked her what that meant, she said they write this in when there were no reported problems. My visit was cut short because they told me that everyone must go to bed at 8:30 and lights out at 9 o'clock. The next day, I checked with the state on the quality review documents of this nursing home and learned that it had a 96% consumer satisfaction rating. When I asked someone in the state, who seemed to be the person who would know, she told me that the nursing home I had visited is, quote, one of the better ones. My first challenge to you today is that you not believe my story, but rather go out and find out for yourself. Seek out someone in a nursing home, any nursing home, and visit him or her unannounced. Don't observe everyone, just this person, not for 10 minutes, but for a day. I know that this may be asking you to turn off your cell phones, beepers, Palm Pilots, and fax machines for that long, but it just may be one of the most productive and motivational days you have spent in a long time. If you can't carve this out of your busy schedule, try it on a weekend. They never close.
Right. I mean, this whole notion, this dichotomy, nursing home safe, community dangerous, where did that come from? Where is the evidence? Where is the proof that abuse, neglect, exploitation is any higher in the community? In fact, all I could find is it's higher in the nursing home. Okay? So where this notion ever got that you get 24 hours of anything wrong, we now know from CMS now. They did a study. On average, it's less than 2 hours of any kind of hands-on assistance per day in a nursing facility. You get less than 20 minutes on average of actual nursing. The rest are the... Pardon me? 5 minutes of actual nursing. They run down the hall with a clipboard, checking boxes. You don't get 24 hours, you get less than 2 hours. You get 5 minutes of nursing, and the rest is like aides and so on, you know, doing very minimal things. You have to look at what are the services provided. I don't care where, I don't care under whose roof, what are those services? Assistance getting out of bed, assistance eating, going to the bathroom, and so on. What does it matter if it's a nursing home, 4 walls and a roof, or your own?
Right.
The services are identical, and the people that are actually doing the hands-on service are identical. And you know something? You can get skilled nursing in the community. You can go to the doctor in the community. You can get therapy there. And most Medicaid programs pay for all of that. You don't have to be in a particular 4 walls and a roof to get the health care, the nursing, and the therapy, and the rest of the services that you need. The actual service is identical.